As several hospitals in the national capital struggle to get oxygen supply, an image of oxygen concentrators lying with the customs department awaiting clearance caused quite some flutter across the country. Amid speculations of 3,000 concentrators stuck due to no clearance by the customs department, the High Court pulled up the centre, asking it to appraise the court about the number of oxygen concentrators awaiting the customs clearance. In fact, the Finance Ministry, however, clarified there, saying no such consignment of oxygen concentrators is awaiting clearance at the customs. Meanwhile, 2 oxygen express trains have brought the biggest single-day load to Delhi. One of the trains, carrying 85 metric tons of oxygen, arrived from Hapa in Gujarat. Another train carrying 120 metric tons of oxygen has arrived in Okhla. Delhi's projected daily oxygen requirement is 976 metric tons. The centre, which had allocated 480 metric tons to the national capital, has now revised it to 590 metric tons. Anisha Mathur joining us live for more details on that. Anisha, we hear that some amount of oxygen has reached Delhi and is now headed towards those hospitals in need. If you can take us through, what's the situation on ground?
Well, Abdullah, at the moment, oxygen supplies are reaching Delhi according to the centre. The Delhi government has also said that they are getting some supplies, but they are still saying that the amount of projected supplies that are needed for Delhi with the ever-increasing numbers, that is not enough, that the total projected supplies are still not reaching the city. But as you just said, the Oxygen Express trains have reached Delhi with about 200 metric tons in total of oxygen that was brought in early this morning. Cylinders have also reached the city, but with the ever-increasing demand, the issue is that the allocated amount is only about 590 tons, while the projected requirements is much beyond that. So the centre and the government, the Delhi government, are currently still coordinating with regard to that. The entire group had yesterday announced that they are once again revising the allocations needed for each state. They're trying to create a plan for allocation of adequate oxygen, because it's not just Delhi but several other states that are facing this similar problem. Just last night at around 2 a.m., the Spinal Injuries Institute in Delhi had set out an SOS message saying that they're running out of oxygen. They have barely about an hour's worth of oxygen left. And emergency cylinders had been sent there by the Delhi government late last night. But that is something that we're seeing in a lot of hospitals. Max, however, has received today an oxygen generator that was sent from France. But that will also not take care of their entire daily requirement, because the requirements are simply beyond what we have been prepared for. The government has said that they're trying to augment the supplies, but that is going to take some days, even as Delhi is gasping for oxygen. And across NCR, you can see serpentine lines outside every oxygen reselling station. And the problem that people cannot get the cylinders refilled, and even hospitals and ambulances are without oxygen, is still persisting. Back to you.
Absolutely tragic, Anisha, for joining us. Thank you for joining us with those details. We're looking at oxygen supply now, reaching some of the hospitals, but still not matching up to that supply that's expected. Now, as Delhi grapples with severe shortage of oxygen, several from the national capital are flocking to Gurugram to get their oxygen cylinders refilled from there. But they are being told that oxygen is being given only to local residents there. Ankit Tyagi brings us this report from the ground.
These massive serpentine queues with people standing with empty oxygen cylinders, waiting for them to be refilled so that they can rush back home and save the life of somebody, their loved one, who is struggling because of COVID-19, have now become a common sight. I mean, you'll see these kind of, lines and these kind of massive gathering outside every refilling plant, not only in Delhi but in the entire NCR region. I'm right now in Manesar industrial area in Gurugram, and this is one filling station where people have been waiting. Most of them have been waiting for since morning, from 6 o'clock, 5 o'clock, somebody came at 10 o'clock, but have not yet got the oxygen. Other problem that people here are facing is that, and this is the first time that I have seen this, at least in the NCR region, at this filling station in the Manesar industrial area, you will only get oxygen if you are a resident of Gurugram, you have residence proof, and your patient is admitted in a hospital or is in home isolation in Gurugram only. If you're from Delhi, Faridabad or any other place, you will not get a refill. That, ladies and gentlemen, is creating a lot of problems. आप कब से खड़े हुए हैं भाई साहब यहाँ?
सर मैं 9-8 बजे से खड़ा हूँ यहाँ सुबह से।
हाँ।
लेकिन वही है कि कुछ गए अंदर और उसके बाद जो है हम लोग वही लाइन में खड़े हैं अभी तक। उसके बाद अभी पता चल रहा है कि गैस भी नहीं है। और दूसरी बात क्या है कि जो 2-4 बंदे जो वापसी आए हैं उनको बोला जा रहा है कि जो दिल्ली की आधार कार्ड है और आईडी प्रूफ जो भी है दिल्ली वाले को मिलेगा नहीं, सिर्फ गुड़गांव
क्या पेपर लेके खड़े हुए हो?
मैं अपने वो कोरोना पॉजिटिव का रिपोर्ट लेके खड़ा हूँ। आधार कार्ड दिल्ली का है हमारा, ये आधार कार्ड लेके खड़ा हूँ। डॉक्टर में का जो प्रिस्क्रिप्शन
दिल्ली से आप सीधे यहाँ पर आए या वहाँ कोशिश करी आपने?
नहीं सर, मैं मोहन कोऑपरेटिव जो है मैं 1 तारीख को 10 बजे रात में जाके लाइन लगा हुआ था। मैं 1 तारीख को 10 बजे रात में लगा लाइन, उसके बाद जो है पूरी रात लाइन में रहा। सुबह को एसडीएम आया 5 बजे सुबह। उसने बोला कि ये 9 बजे लाइन खुलेगी, 9 बजे अंदर किया जाएगा सुबह दिन में 2 तारीख को।
दिल्ली में भी आपने कई जगह पे करा, वहाँ पे मिल नहीं पाई आपको?
नहीं मिला सर, पूरा रात भी खड़ा रहा, दिन भी खड़ा रहा और शाम को एसडीएम आया, बोल दिया कि गैस
वहाँ से नहीं मिला, तो इस वजह से आप यहाँ पर आए। अब यहाँ बता रहे हैं कि दिल्ली वालों को नहीं मिलेगा।
हाँ, दिल्ली वाले को
आप कहाँ से भैया?
मैं सर यहाँ गुड़गांव से हूँ।
हाँ।
कल मैं 3 बजे से लाइन में लगा हूँ और जब मेरा यहाँ तक नंबर आया तो बोल रहे हैं 9 बजे रात की गैस नहीं है। फिर मैं सुबह आके 6 बजे लाइन में लगा, अंदर पहुँचा, वहाँ गेट तक बोल रहे हैं गैस खत्म हो गई।
आपके कौन है घर
हमारे
पे?
भाई है और भाभी दोनों एडमिट हैं हॉस्पिटल में।
हॉस्पिटल में भी ऑक्सीजन नहीं है?
हॉस्पिटल वाले बोल रहे हैं अपनी ऑक्सीजन लेकर के आओ,
अपनी खुद ऑक्सीजन
खुद ऑक्सीजन लेकर आओ,
आपके
नहीं तो पेशेंट को लेके जाओ।
आपके जो भाई हैं वो गुड़गांव में हॉस्पिटल में है?
जी गुड़गांव हॉस्पिटल में है।
तो इस वजह से आपको मतलब यहाँ पे जाने देते हैं, लेकिन ऑक्सीजन बोलते हैं खत्म हो गया।
ऑक्सीजन खत्म हो गई।
मैं सुबह 7 बजे से खड़े हुए हैं, कहीं भी दिल्ली में कहीं भी नहीं मिले, सारे जगह घूम घाम करके कोई बोला मानेसर में मिलता है, यहाँ आए सुबह 7 बजे से और बैठे हुए हैं। 4 बजे बोल रहे गैस खत्म हो गया, फिर कह रहे दिल्ली वाले का जो पेपर है उससे कोई काम नहीं होगा।
Are you also standing for oxygen here? आप भी खड़े हुए?
कल 3 बजे से हूँ।
Yesterday 3 o'clock in the afternoon.
या आई एम स्टैंडिंग फ्रॉम यस्टरडे। अभी वहाँ पे मेरा 7वां नंबर है, गैस खत्म हो गई।
अच्छा, आपका सिलेंडर अंदर है?
अंदर है सिलेंडर,
बट गैस खत्म हो गया?
गैस खत्म हो गई।
Are you a local resident?
लोकल रेजिडेंट
From Gurugram?
गुड़गांव।
What do you, I mean, who's there in your house who's COVID
My
positive?
sister is with saturation level is at 63. She is now battling with life.
और आप यहाँ पे वेट कर रहे हैं मजबूर?
कर रहा हूँ।
हॉस्पिटल का बेड नहीं मिल पा रहा कहीं?
नहीं, कहीं बैठ नहीं मिल पा रहा। They are saying you have to come up with your oxygen. Pathetic situation. This is worst I have never seen in my life or never seen in India. Deplorable situation.
You know, there is, I don't know what is it that you can say to people like this. कब आप भी ऑक्सीजन के लिए खड़े हो? कब से?
कल रात से
नहीं मिला अभी तक?
नहीं मिला। अगर आज ऑक्सीजन नहीं मिला तो फांसी लगा के मरूंगा यहीं पे। बहुत ज़्यादा सीरियस है हमारा पेशेंट।
कहाँ पर है? दिल्ली में, गुड़गांव में?
गुड़गांव में।
Amid the rising cases in the national capital, the Delhi government sends out an SOS to Defence Minister Rajnath Singh seeking Army's help here in this COVID pandemic fight. Delhi government sought the Army's help to set up 10,000 oxygen, oxygen tankers and cylinders, about 1,000 ICU beds in the national capital. The High Court has asked the centre to now revert to the government's request at the earliest and see what can be done. Here's more on that.
The government has sent an SOS to Defence Minister Rajnath Singh seeking the Army's urgent intervention to set up an additional 1,000-bed ICU COVID facility, non-ICU COVID quarantine centres and to provide any other assistance possible in the multi-layered crisis in the capital. The 1.1 million strong Indian Army has unmatched logistical strength and this could be enlisted now on a war footing. For instance, rapid vehicle fleets for emergency supply and delivery of oxygen and drugs between states and cities. The Army can rapidly set up COVID facilities in any part of the country at short notice. The Army can also deploy its huge manpower and supply chain logistics to speed up vaccine delivery. It can deploy medical staff and manpower to scale up testing anywhere very, very quickly. And it can provide rapid strength for containment area enforcement in any part of the country. The government has set up a special COVID crisis committee under the Integrated Defence Headquarters to coordinate relief efforts both within the military as well as aid to civil authority. The panel is headed by Lieutenant General Madhuri Kanitkar, who already has a battle plan for Delhi and beyond wherever required.
The armed forces is ready. It has been ready for a while, and though we've been fighting this war against COVID for the last 14 months, I assure the nation that we are all ready. In normal war, we have our soldiers up front and we medical people are the shoulders. But today in this war, with the virus as the enemy, the doctors and the healthcare workers and all of us, we are the soldiers, but we have strong shoulders with us. So it's a co-jeet. We cannot do this alone. And our senior leadership is supporting us in every way.
The Indian Army is already deployed in the COVID fight. For instance, last week, the Defence Minister granted the Armed Forces emergency access to funds to set up and operate quarantine and treatment facilities for COVID patients. Before that, the Defence Ministry announced it was roping in 600 retired doctors to be deployed in the COVID battlefield. The Army has also extended the tenure of all Short Service Commission doctors till the 31st of December this year to have all hands on deck. But the current crisis means the Army's full strength will potentially be required to win the war. The Army's sister services, the Air Force and Navy, in oxygen logistics duties from home and abroad. With Delhi formally calling for the Army, has the war against COVID entered its most decisive phase? With Gaurav Sawant and Abhishek Bhalla in Delhi, Bureau Report, India Today.
Now, in a horrific incident, 24 patients, including some COVID-19 positive patients, died at a hospital in Karnataka, allegedly due to oxygen shortage. The patients died at Chamarajanagar District Hospital after the hospital ran out of oxygen supplies. Here's what happened. Let's take a listen.
24 lives. Yes, 24 lives have simply evaporated here in one single night. The new horror to hit Karnataka here in Chamarajanagar on Sunday. The reason for most of them, all too familiar now, is that oxygen supplies ran out. Officials tell India Today that 23 patients died at the district COVID hospital and one at a private hospital. 12 patients died due to lack of oxygen, while others died of COVID-related complications. Sources say the oxygen plant at the hospital had run short of oxygen by Sunday night. The 6,000-litre capacity oxygen plant on the hospital premises can sustain the oxygen needs for 1.5 days only. But locals alleged that the authorities were fabricating the number of deaths. They claimed that even non-COVID patients had to face oxygen shortage, resulting in their deaths.
75% recovery ಆಗಿದೆ ಸರ್. ಸಿಲಿಂಡರ್ ಇದ್ದಿದ್ರೆ ಮನೆಗೆ ಬಿಡೋದು ಸರ್. ಆಕ್ಸಿಜನ್ ಇದ್ರೆ ಮನೆಗೆ ಬಿಡೋದು ಸರ್.
Chief Minister B.S. Yediyurappa expressed grief regarding the deaths and said that the government stands firmly with the family members. He also ordered an inquiry headed by a senior IAS officer. Health Minister Dr. K. Sudhakar, who immediately rushed to the hospital 175 kilometers away from Bengaluru, said that he will have to ascertain what really happened.
ಚಾಮರಾಜನಗರದ ಘಟನೆ ನಿಜವಾಗಿಯೂ ಕೂಡ ಬಹಳ ನೋವಿನ ಸಂಗತಿ, ಅತ್ಯಂತ ದುರದೃಷ್ಟಕರವಾಗಿರುವಂಥದ್ದು. ಈಗ ಮಾನ್ಯ ಮುಖ್ಯಮಂತ್ರಿಗಳ ಜೊತೆ ಚರ್ಚೆ ಮಾಡಿದ್ದೇನೆ. ಇಲ್ಲಿಂದ ಈಗ ತಕ್ಷಣ ನಾನು ಚಾಮರಾಜನಗರಕ್ಕೆ, ಮೈಸೂರಿಗೆ ಮತ್ತು ಮಂಡ್ಯಕ್ಕೆ 3 ಜಿಲ್ಲೆಗಳಿಗೆ ಭೇಟಿಯನ್ನು ಕೊಟ್ಟು.
Local residents protested when the health minister arrived at the hospital and the police had to detain them. But the Congress has questioned the government, asking whether this was a case of COVID mismanagement.
There's a criminal neglect by the government of Karnataka. They don't seem to have a blueprint in place for us to get out of the pandemic. They don't seem to know the way forward on how to deal with the logistics for oxygen. They don't seem to have a plan for the increasing lack of facilities of health infrastructure in the rural areas.
Now, this is the latest tragedy to hit Karnataka, a state already reeling with a record number of COVID-positive cases, topped off with last week's admission from the state government that 3,000 plus COVID-positive persons are still untraceable. With video journalist Madhuar, Nolan Pinto for India Today.
Meanwhile, Tamil Nadu has now announced fresh restrictions from Thursday until 20th of May, as the state has now recorded over 20,000 fresh COVID cases. In fact, government has now said that there will be fresh restrictions, including only 50% capacity of staff members. Both private and government offices will be allowed to function. Trains, metro, bus, taxi will be allowed only 50% passengers. Restaurants have been permitted to provide takeaways until 12 noon. Standalone groceries and vegetable stores can open up only till 12 noon. Spas, gyms, malls, theatres, recreational centres will be shut. Shops dealing in essential items, though, including medical supplies, will be allowed to function as usual. Night curfew from 10 p.m. to 4 a.m. and total Sunday lockdown will continue in the state until 20th of May. Meanwhile, Tamil Nadu Chief Minister-elect M.K. Stalin has announced that journalists will be treated as frontline workers. Tamil Nadu has seen 20,000 cases in 2 consecutive days. Remember, we saw right after the 2nd May results, people were out on the streets, DMK workers, they're particularly celebrating in huge numbers without social distancing, many of them not wearing their masks. Of course, now we're looking at the last 24 hours, 20,000 and above COVID-19 positive cases have been reported. And in light of growing cases, we're looking at fresh curbs that's been imposed. Pramod Madhav for more details on that. Pramod, take us through. We saw on one hand the DMK workers out there celebrating, not adhering to COVID protocols just a day ago, and now the government has decided that fresh curbs will be implemented.
Absolutely. This decision was taken almost like a week ago when we met with the corporation officials. They very clearly mentioned that based on the number of cases that are being registered, for instance, if it is 10,000, certain regulations was already planned to be imposed, and currently we are having 20,000. And that's the reason almost a week back the state government said that malls, gyms, theatres and everything will be closed and no public access will be provided to control the crowd. And currently, as we have reached 20,000 cases per day, and as the positive cases are above until yesterday it was 1.19 lakh cases, and that's the reason some severe restrictions have also been imposed, by which they have reduced the number, the timings for shops actually. Earlier, restaurants and tea stalls were providing only takeaway services. That has also been reduced, will be reduced from 6th May onwards. That is, like, shops can only work until 12 p.m. This is going to be very big because it's going to cause a lot of hindrance to the public. But however, the authorities claim that there is no other way, as the cases have grown over 20,000 currently, and the active cases are 1.19 lakh, whereas the beds in the state of Tamil Nadu is 90,000, and that's the reason the officials claim that such decision has to be taken.
Well, Pramod, thank you very much for joining us with those details. We know several states have independently taken a call to announce a lockdown or curbs in their states, but will there be a national lockdown? Here we have some news coming in. Rahul Gandhi now pushes for a full lockdown. He tweets, and I quote, "Government of India doesn't get it. The only way to stop the spread of corona now is a full lockdown with the protection of Nyay for the vulnerable sex. Centre's inaction is killing many innocent people." Here's Rahul Gandhi, Congress MP now, pushing for a complete lockdown. He tweets, and I quote, "Government of India doesn't get it. The only way to stop the spread of corona now is a full lockdown with the protection of Nyay for the vulnerable sections. The centre's inaction is killing many innocent people." Remember, India has now recorded over 4 lakh cases. They've seen a slight dip in the last day or two, but we have inched closer to 4 lakh COVID positive cases in a single day for just the last 1 week itself, consecutively. Here we're seeing several states independently who have now taken a decision to go into a small 1 week or 2 lockdown or curbs in place to curb this virus spread. Now, opposition party leaders asking for a complete lockdown in the country. Meanwhile, Rajasthan has been badly hit by the 2nd wave of COVID-19. Hospitals are bursting at the seams, and patients there are struggling to find a bed there, oxygen supply shortage. We are looking at visuals that are painful. Let's take a look at this ground report from Jodhpur.
Magnificent forts, bright blue clusters, deserts, But Jodhpur in Rajasthan is now broken, barren and battered. The district recorded more than 2,200 cases on Sunday alone. The biggest of its hospitals have now run out of beds, oxygen, and even doctors and nurses.
There is a waiting for more than 24 hours. So you can understand the situation that the patients who are gasping for breath are actually waiting at the lobbies and the corridors of the hospital. कितने देर से बैठे हैं आप लोग?
2-3 घंटा आएगा।
3 घंटा से बैठे हैं आप। सुबह 10:15 बजे आए थे और अब तक बेड नहीं मिल पा रहा है।
बेड नहीं मिल पा रहा है। ओसिया से आए।
कब से आप लोग खड़े हैं यहाँ पे?
2 घंटा हो गए।
अभी तक अस्पताल में डॉक्टर क्या बोल रहे हैं? कब तक बेड मिलेगा?
रिपोर्ट लिया है, वापस आ रहा है, क्या बोले क्या नहीं बोले। अभी तो कुछ सुधार हुआ।
अभी तक कुछ नहीं मिला पड़ा है।
अभी तक कुछ नहीं हुआ।
Distraught patients, their families waiting for a bed for hours together.
ऑक्सीजन सिलेंडर भी पर्सनल है हमारा।
अच्छा, आप लोग खुद लेकर आए हैं ऑक्सीजन सिलेंडर?
जी हाँ।
With 10 minutes of oxygen left in the cylinder, he stretchered his mother out to look for a bed elsewhere.
मौत का आंकड़ा बढ़ रहा है, उसी अनुपात में बढ़ रहा है जिस अनुपात में मरीज बढ़ रहे हैं। दूसरी बात, इस बार जो स्ट्रेन आया है, हमने ये देखा है, हमने ये भी पता है कि जोधपुर में लगभग 1000 के आसपास सीटी स्कैन हो रहे हैं और ज़्यादातर में आप पाएंगे कि लंग संक्रमण बहुत जल्दी होता है, फेफड़े बहुत जल्दी संक्रमित होते हैं और ये संक्रमण बहुत तेजी से फैलता है।
Kota district officially recorded 601 cases on Sunday, but an overrun health infrastructure presents a scarier picture. Many patients left to their own devices. About 18,300 new infections were registered across Rajasthan on Sunday. Remote areas, small towns and villages with limited access to healthcare stand highly vulnerable to strains that have ravaged urban India in the second wave. With Tanushree Pandey in Jodhpur, Bureau Report, India Today.
Well, it's not just Buxar, but the plight of COVID patients is no better in Ara district of Bihar. A COVID patient kept on pleading for treatment at the hospital, but that fell on deaf ears. India Today's Ashutosh Mishra also requested those nurses and doctors, but to no avail. Here's what really happened.
एक मरीज मर गया, दूसरे की हालत बिगड़ रही है यहाँ पे। कौन होगा जिम्मेदार? किसकी जवाबदेही तय होगी? यहाँ लोग मर रहे हैं।
This is the plight of COVID patients in Ara in Bihar. Ram Shankar kept begging, kept asking for help. From the nurse to the helpline, from anyone and everyone.
कोविड वार्ड में एक मरीज है, उनकी हालत एकदम खराब हो रही है सर। उनका ऑक्सीजन जो है 40 के नीचे आ गया है।
We tried to help him as he fought for his life, one breath at a time. And he died right in front of our cameras, without any help, leaving behind a devastated son. Unfortunately, Ram Shankar is not an isolated case. Many are dying without treatment in the Sadar Hospital in Ara, which is currently in shambles. The ICU is a warehouse. Beds with ventilators have been non-functional for 8 months. The hospital doesn't even have electricity. So this woman can't even give her husband the nebulizer.
बोला था किसी ने? हाँ, डॉक्टर साहब ने बोले हैं कि नेबुलाइजर 3 टाइम देना है, लेकिन हम बिजली की वजह से अभी तक नेबुलाइजर उनको नहीं दे पा रहे हैं। और उनका हाथ भी तेज हो गया है सर।
लाइट कब से नहीं है?
लाइट 24 घंटा हो गया, पूरी रात लाइन नहीं है। रात में 10 बजे से लाइन कटी हुई है।
No doctor or nurse appears in the ward till noon, and the kin are left to take care of the patients themselves.
COVID reporting surge in the state of Bihar, the crumbling state of affairs here in Ara. The restricted area, a COVID ward, but look at the affairs, how the patients are left on their own. It is only the attendants who have been forced now to even provide oxygen, though the cylinders are available.
Ram Shankar was admitted to the Sadar hospital because his oxygen levels started dropping. But his son says that Ram Shankar received no treatment at all.
कोई आया देखने के लिए, नर्स
आ रही है ना डॉक्टर आ रहा है।
कब से नहीं आए भैया?
क्या हम
से नहीं आए देखने के लिए?
कहाँ आए हैं अभी तक?
भैया देख लो, शायद जिंदा हो, सांस ले रहे हो।
When Ram Shankar was struggling to breathe, we asked for help from the nurse and the doctor on duty, but nothing happened. There are 3 ventilator beds right above the COVID-19 wards, but they are padlocked.
ऊपर से जब ओपन करेंगे तब ना हम लोग इसका यूज करेंगे।
खुला नहीं है अभी। कब से ताला बंद है?
ये तो जब से डेट ऑफ ज्वाइनिंग ताला बंद है।
कितने दिन हो गए?
करीब 8 महीना।
The waterlogged ICU is more of a warehouse that stocks medicines and machines. When we asked the doctor on duty why there was no electricity in the hospital, she was evasive. We pleaded with her that a patient was in serious need of medical help. But all she said was she, a doctor, will soon go to check on Ram Shankar.
एक बार कोशिश कर सकती है, शायद जान बच जाती है। पहले एक आदमी तड़प रहा, उसकी जान बचाने की कोशिश कर।
We also called the number on this poster outside the COVID ward. But while we were explaining how dire Ram Shankar's situation was, the person hung up on us.
एक रमा शंकर साहा है, देखिए भैया वार्ड में उनकी तबीयत बिगड़ गई है, 40 के नीचे आ गया है ऑक्सीजन, कुछ कीजिए ना जल्दी से।
अच्छा, वहाँ ठीक है, वहाँ बात करते हैं।
यहाँ कोई डॉक्टर ही नहीं है, लाइट भी नहीं है। वो
A relative of another patient breaks down while talking about how he has been trying to get help for his loved one.
एक भाई अभी डेथ कर गए
आपके?
हाँ, और एक भाई अभी भर्ती हैं।
कोई किसी को फोन किया होगा आपने, कुछ तो कोशिश की होगी, कोई आए यहाँ पर देखने के लिए?
फोन कोई नहीं उठा रहा है।
While this horror unfolds right in front of their eyes, the focus of the ARA administration is completely elsewhere.
जो CS इंचार्ज है, वो बस डिस्चार्ज करने आता है। आएगा यहाँ पे
डिस्चार्ज करके यहाँ पे फूलमाला पहना है उस दिन। परसों फूलमाला पहना है कि ले जाओ, ठीक है मरीज। ऑक्सीजन पर नाप दिए 93 है, बिना ऑक्सीजन का नाप में नहीं किए, ले जाओ ठीक है। यहाँ पर लेकर आए और मरीज मेरा लेट गया नीचे में।
मरीज मेरी आंख के सामने मर गया। हमने डॉक्टरों को भी फोन किया, अस्पताल में हेल्पलाइन नंबर पे भी फोन किया, नहीं उठाया किसी ने फोन, कोई मदद नहीं आई है। ये नहीं देखना चाहते हम। कौन लेगा जिम्मेदार? कौन होगा जिम्मेदार?
We saw firsthand the shocking apathy of a medical system which has collapsed as patients suffer and succumb with their loved ones watching helplessly. With Ashutosh Mishra in Ara, Bureau Report, India Today.
I'm going to take you through the numbers of the worst hit states in the country. Let me start with Maharashtra right on top. COVID-19 cases in the last 24 hours has seen a slight dip in Maharashtra. 48,621 cases that's been reported. And then you have Karnataka that's now reported 44,438 cases in the state. You have Uttar Pradesh there, that's reported 29,052 cases in the last 24 hours. Then you have Kerala, that's reported 26,011 cases in 24 hours. Tamil Nadu following that at 20,952 cases in the last 24 hours.